Hello, doctor. Welcome to Health for Her channel. So let's begin with the questions. So what are fibroids and how do they occur?
Fibroids are muscular swellings which arise from the uterus. And they are simple swellings. They are not cancerous. About 20% of women in the reproductive years are affected by fibroids. They can vary in size, shape, and location. They can be as small as something which is not visible to the naked eye or big enough to form a lump or a swelling. They can appear from the muscle of the uterus or from the outer surface of the uterus. Sometimes they can grow towards the cavity. The exact reason why this happens is difficult to define, but the female hormones are definitely responsible because during pregnancy, when there is an abundance of hormones, we find these fibroids to increase in size. Whereas during menopause, when the hormones go down, these fibroids shrink.
Okay. So what about the symptoms? What can they cause and how do you treat them?
You'll be surprised to know that 75% of the fibroids, even the large ones, do not cause much symptoms. But when they do, they can cause heavy bleeding, painful cycles, and the bleeding can lead to anemia also. Sometimes when they are big, they can cause pressure symptoms where the patient will have lower abdomen discomfort and back pain. It can also lead to difficulty in emptying the bladder. Now, as far as treatment is concerned, if you are not having symptoms, we usually tend to wait and see. Heavy bleeding and pain can very well be controlled with medicines. But if there are very big fibroids, which are not responding to the medical treatment, and the woman wants to plan pregnancy, then we also look for surgical interventions. So if she's wanting more pregnancies, we can do a myomectomy wherein we remove the fibroid but conserve the uterus. Sometimes if the fibroid is very big, she does not want further pregnancies, the medical management is not helping her, then we can think of a hysterectomy also, which is removing the uterus along with the fibroid.